Eyewitness News is your vaccine authority, and we are starting off the week answering your questions. Joining us live now is Dr. Henry Anyimadu, infectious diseases specialist with Hartford HealthCare. Doctor, thank you so much for being with us.
Always a pleasure to be here, Erin.
Always appreciate having you as well. Let's get right to it. The first question. Some people say they have worse side effects after their second shot. Why is that?
Well, it is expected to have side effects with the first and the second shot. Most people in the clinical trials had those side effects with the second shot. And as we know, the first shot is more like a primer, and the second shot is a booster. So as your immune system is ramping up, that's when you have those mild side effects that usually would go away within 1 to 2 days. So it is expected that you may have more of these side effects with your second dose.
And no cause for concerns, just means your immune system is all working. Let's get to Elizabeth's question right now. She wants to know, this is more specific, how long should you wait to take the COVID-19 vaccine after you take your birth control shot?
You know, you really don't need to wait after you get a birth control shot. There is no contraindication with a birth control shot. For the vaccines, you can get your vaccine right away. In fact, it's actually recommended that people that are on birth control pills or shots get their vaccine, because we know that birth control sometimes can put you at risk of having blood clots. And COVID-19 also increases your chances of getting a blood clot. So the earlier you get your vaccine, the better. And there is no contraindication at all. You can get it right away or a few days later.
Well, that is good to know. Our last question here, how long does it take for the vaccine to start working? That's obviously a big question on everyone's mind.
That's right. So the CDC considers you fully vaccinated when you're 2 weeks away from your second dose of the Moderna or the Pfizer vaccine, or 2 weeks from the one-shot Johnson & Johnson vaccine.
Okay. A lot of good information as always. Thank you again for taking some time to spend with us this afternoon. Dr. Henry Anyimadu with Hartford HealthCare. Thank you.
You're very welcome, Erin.
We will see you soon.